Good morning. I'm Laura Jackson from EPA's Office of Research and Development in North Carolina. I'm very happy to be here. I appreciate the invitation. I would like to talk about a couple of tools that we're developing in the EPA with multiple partners to project the benefits and geographic location and potential future for ecosystem services, and today with a particular emphasis on how they translate to elements of public health and well-being. And so I'd like to start out with the next slide to take a very short tour. Oh, I'm the one who's doing this. I will be asking for some help in the back to do a little short tour of an online tool that we currently have, the EcoHealth Relationship Browser, which is on EPA's public website. And this is basically a fun interface of a large literature review that also builds on the literature reviews of others that we heard a little bit about yesterday from the CDC. To make easily accessible to the public the information that exists on associations at the very least, and many times causal relationships between functions of the environment and either buffering capacity of ecosystems that protects human health from hazards, and also the other element is a health promotional aspect of ecosystem services that encourages healthful behaviors. So if I could get a little collaboration from the IT folks in the back to click on this hyperlink here in yellow at the bottom, that takes us hopefully to an introduction page that shows people how to use the browser on EPA's website. So if you'll just page all the way down, we'll click right to the tool, since I'll run it and you won't have to figure it out today, but hopefully you'll explore it on your own when you have a moment. So what we've done, and just try to get a little bit more of it on there, there are 4 ecosystems that we feature currently in the browser, and for this workshop, the urban ecosystem seems the most appropriate, and that is the opening bubble here. When we feature 6 ecosystem services, there are others, but these are some major ones around the outside, and as is being demonstrated, the really important part of the browser are these little plus signs that link whatever's in the center to whatever's around the outside, which explains the association that has been documented in the published literature. Now we summarize the more strong findings, the findings with larger sample sizes, the ones that seem the most robust. And I think you already showed you can scroll down in one of those pop-up boxes too if the information goes on beyond what's visible. There's shows a number of studies, talks about a number of different findings. There's also a bibliography link. If you scroll up to the back, to the top of the whole screen, there is on the, there in the lower in the gray, there will be a bibliography to open a new window to show everything that's been cited in the browser. We don't have to see it if it doesn't come up, with abstracts where a user can go look for more information. So one of my favorite ones that I'll just highlight would be the engagement with nature. If you can click on that ecosystem service that gives people the opportunity to experience nature, where several things can happen. One, there are studies that show that is more conducive to interacting with neighbors and others in the community. So that leads to healthful benefits. There may also be some sort of just biophilic connection where, because we're natural organisms like any other, we've evolved in the natural environment, and it may be that just being in a green setting with other natural elements actually helps our bodies develop more properly, cognitive development and physical development, and that is as yet unproven hypothesis that has been talked about for a long time. So that is certainly an area where I think lends itself well to laboratory studies of different kinds of animal studies with different kinds of maturation exposure, natural versus more artificial, and looking at different kinds of cognitive testing, for example. So there are some things here that are, as I said, purely associations that have been observed with school children, with people who live in more captive populations like public housing, military bases, prisons, where people have less opportunity to get out and experience other environments besides their residential setting. that show improvements from views of windows, from being able to access green patches outdoors as opposed to pavement, that sort of thing. So this is a fun way to interact with the literature, and this is something we wanted to make available to students and researchers, as well as householders, individual families, and local governments to think about what has been demonstrated to date that is perhaps persuasive evidence for making changes in the urban ecosystem environment that can have multiple benefits with one kind of decision, like tree planting, may affect multiple health outcomes. So I'll go back to my slides now and continue on to discuss the national, well, we now call it the Enviro Atlas, which is another tool that is being peer-reviewed in April, so it's not yet public, but it will be very shortly. And this covers the coterminous U.S., and again covers a wide suite of ecosystem services mapped at the 12-digit HUC watershed scale. And this is just one screenshot. I'm not going to do a demo of the atlas since we don't have a public link to the atlas yet. We have multiple federal partners, including the Forest Service and USGS here today. And hopefully there's some folks from NRCS. I know we've heard a lot from USDA yesterday. So the 12-digit HUCs are really fine resolution for this national coverage. There's also a community component that is summarized at the block group scale. And we also have foundational maps. So it's not just summary maps, but you can also look at the base data, such as some of the things that Jarlath was portraying. We don't use LiDAR data currently in the community component, but you can look at the 30-meter data and the 1-meter data and other foundational data, as well as the summary information that's useful for comparing across units. So there are a lot of questions that we're using to develop the atlas. I wanted to highlight here, just at the bottom, that we are trying to communicate how these services do have an impact to health and well-being as far as what we understand in the state of the science. I think that we've talked a lot with members of the health community. We've been talking with CDC. We talk with state and local health departments and our own health colleagues at the EPA. I think the issue that really does seem to hit home with our colleagues in the health field is the implications that are expected to occur from climate change and the important role of ecosystem services to buffer populations from more extreme storms, more frequent severe events, droughts, other things like that. We're also making a big case for environmental justice. In the health fields, public health now is looking a lot at social factors that are perhaps exacerbating certainly toxicology effects from chemical exposures, cumulative effects. The resiliency of a community is a factor in how much these exposures are going to affect populations. And we are making the argument, and I think it's true, that a degraded urban ecosystem is really a form of blight and really does add to cumulative impacts. It certainly takes away a lot of that buffering capacity. And also, it detracts from the opportunity for these health promotional services that urban ecosystems, and certainly urban forests are a big part of the urban ecosystems that we've been studying and mapping, that it decreases resiliency and increases vulnerability, particularly in disadvantaged areas where there's already so many multiple impacts from different sources, social and environmental. We do have a big environmental justice plan at the EPA, and the Enviro Atlas is a part of our research response to what we've heard from various environmental justice workshops where people have really demanded that EPA do more to address disadvantaged and overburdened communities. So the community component of the Atlas is all one tool, but you can zoom in and use other buttons to look more finely, and this is just background like Bing mapping of what's on the ground that everyone's real familiar with from Google type tools. We are using iTree to a large extent. They're our strongest partner for the community component. Fully half of our metrics right now in the community component are from iTree and iTree's calculation of BenMap air quality benefits values that Dave explained previously. But we're also continuing to do new research. It's been really wonderful to have some of these out-of-the-box metrics that we can populate the atlas with to start out and really demonstrate its potential. But we know that we have a long way to go with really refining and adding metrics. We're trying to have metrics that are, we need to have metrics that are consistent across the country. We don't have a lot of funding for field work, so we're really trying to do a lot of this using remote data and leverage data from other sources. We are hoping that communities are going to be able to add their own data. It's similar to how you can have your own project in Google, so you can add data that may be confidential and that other people won't be able to see, but you can use and analyze in conjunction with Atlas data. So we're really trying to get in the health component of valuing ecosystem services is actual health outcomes. And fortunately, with the BenMap program, we are able to talk about adverse health impacts that are avoided due to the filtration of criteria pollutants from the tree canopy. We're also really mining the literature. You know, we started out by developing the EcoHealth relationship browser, and now we're using the information in the browser, which is current as of the end of 2012, to see what kinds of studies have, what kinds of coefficients, what kinds of confidence have people found in their associations between, say, views of trees outside of residences and decrease in domestic violence, or increase in test scores, or increased healing, distance to parks, just percent green space within different buffers of homes and schools. There's all kinds of studies out there. The problem is that there's not that many studies that use the same variables in the same way that you can really do a good meta-analysis. So, you know, we don't think the EPA is really going to go for us publishing maps of, you know, reduced risk of mortality, you know, due to the number of street trees. I don't think we can get that past our clearance process. So we do have fact sheets that go with all of our map layers that explain qualitatively what's been found in the literature, but it's certainly not a prescription. And of course, there are so many other things that go into health outcomes, genetics and behavior and so many things. But we are hoping we can at least get to mapping some magnitudes, so expected magnitudes of risk. Going to be much higher here, all else being equal, to have, you know, mold in your home from flooding than over here. And of course, these are screening tools too. Certainly, I want to emphasize that you'd have to really go down into a community and do much more work locally to refine spatial kinds of projections of risk. But we do think it's very helpful to get like a broad brush comparison of, you know, particularly if you see a lot of the sort of suspicious areas of where there may be real inequitable distribution of these potentially beneficial resources, then that, you know, certainly is a good place to start looking for, you know, exactly how these spatial relationships work out on the ground. So we will continue to try to move more quantitatively as we can, and as in-house and research all around out there at many institutions addresses this issue, which is really burgeoning, and we're seeing just an exponential growth in publications on this subject. So BenMap, which Dave alluded to briefly, did do a giant meta-analysis because there is a tremendous amount of information that's consistent about the effects of air pollution on human health. And so they use the strength of different studies to be able to develop sort of average coefficients as multipliers for reductions in air pollutants. And so just as an example of what this looks like in the atlas at the block group scale for a community, this is our first community that will be posted when the atlas is peer-reviewed in April. Shows just different outcomes based on the population distribution for the reduction in various criteria air pollutants that are very tiny up here at the top, just to give you a general idea of what the display looks like. So one of the in-house studies, and we are collaborating with Tom Whitlow and other people on near-road air pollution, just to give you an example of what some of the things we're trying to make as clean as the BenMap results, would be some of these studies on near-road vegetative buffers and their effectiveness in perhaps trapping or diverting polluted plumes from the roadway. And we have wind tunnel studies here that show a very good relationship between penetration and particle size through a wind tunnel. We have computational fluid dynamics modeling results that show greater mixing when you have a buffer that pushes the plume up higher in the atmosphere, so it's diluted. Now, when we get into the field, results are more messy, as often is the case, but we do see strong buffering by various heights of tree rows from ultrafines. All this data is regarding ultrafines, but there are a lot of caveats. It really depends on the species, it depends on the seasonality, depends on the grade, it depends on the wind and on the traffic volumes. So not really quite ready for giving prescriptions about tree planting next to roads, although we are mapping the tree buffers in the atlas because we think this is promising. This probably is going to result in some sort of quantified finding about buffers, at least for certain species. Evergreens are looking better than deciduous trees. And so, just broad brush again, where you don't have any tree buffers by major roads. Maybe if you're planning on siting a school or a rest home next to really close to a road like that, you might want to think about tree planting or a different site design because you can pretty much count on roadway pollution within that 300-meter buffer zone that is characteristically accepted as a higher exposure zone. And where you have the higher, more green is more and more tree buffering, more likely to have some protective effect. So we're mapping, then we summarize it by block groups so you can compare not just within a city, but across cities. And in the whole atlas, comparing watersheds, we also have an index tool that shows how multiple ecosystems are doing in every kind of watershed or block group. So leading towards an index where you can stack these ecosystem services and see, like, oh, this was really good for air filtration, but not so great for water storage. And so you can get the whole picture at once, as that's just so important rather than trying to address one problem at a time everywhere, which is just not working and very cost ineffective, to say the least. So let's see, I have a screen here. So we summarize things at the block group scale. We can even estimate the population that is within the buffer using densitometric techniques where we take the census data at the block scale and drive it down into the 30-meter pixel using exclusion rules like, people aren't going to be in water or in parks or in farmland, that sort of thing. It works really well in rural areas where you have a lot more of that kind of exclusionary area in question, and in cities that we have less naturally excluded areas, but it does still help us refine where the population is more likely to be in the entire block. So just quickly, some other things we're looking at. We take the densitometric pixels and we make a 50-meter buffer around them. A lot of this is just very first pass, broad brush. I don't know how much, the literature doesn't say how much trees you need outside your window to feel happier, or to not beat your wife, or, it's just not really clear. But I think we could say that if you don't have any trees outside your window, it's probably worse than if you have some. So, for instance, in this map, it's a summary of the densitometric pixels that don't have any tree cover, or less than 5%, in a 50-meter buffer around a densitometric pixel. Are there people in that densitometric pixel as we projected? Don't know for sure. Can they see outside of their window? Maybe there's a high-rise right next to them. Those sorts of things, you can't really see in this screening tool, but it is a first pass, and it is getting us down this road where we haven't been before, at least in the EPA, and it is getting us closer to thinking about how the environment really impacts the population on a day-to-day basis on some very important issues like some of the health issues listed here. And with population data, then we can also overlay where you have some maybe more particularly vulnerable subpopulations like the elderly or low income or particular minorities, people who don't have English as a first language. They may be, for different types of environmental threats, may be differentially susceptible. So you can look at areas, for example, where there's lower green space, which is supposed to be correlated with longevity, presumably for more opportunities for physical exercise and social interaction, and where you have maybe greater populations of the elderly, which would be the larger brown circles. So where you have lighter green block groups with large brown circles, areas you might want to look at for increasing urban green space to benefit the health effects that have been demonstrated to correlate at least with longevity in the elderly and physical function and mental acuity and other things like that. Other ways of displaying the data. I want to finish with some, boy, there's a lot of things that we don't know and could use additional research on. Just being able to do meta-analyses requires more replicable studies, and we are funding some ourselves, but it's, you know, it's slow going. Using, we would like to see more study designs that really focus on trying to determine causation. I mentioned animal studies and looking at this idea about, you know, sort of an innate biophilia in living in organisms that may enhance physical and mental development. More information on mechanistic pathways. We know that stress is a big, is alleviated with exposure to green space, either because of physical activity or interaction with other people. Certainly, we understand the mechanisms of trees entrapping pollutants much better than we understand why, you know, happiness is increased with a walk in the woods. Just more, moving more beyond associative research into more explaining why these things are happening. We have a lot of problems accessing public health data, you know, a lot of confidentiality restrictions on individual data, but you really need it at a fine scale. You know, county level data is just not really going to help in these kinds of analyses, in my opinion, because, you know, a county is so heterogeneous, both socioeconomically and environmentally, that you're really collapsing all your data towards the mean, and it's really not telling you very much. In fact, it can be very misleading. So, I mean, at least if you had data by school district or by, you know, block group, or ideally residential or individual school data would be awesome, hospital data. And you can have proxies like school performance and prescription drug use and sales gives you some idea of ailments that are prevalent in the population. So we're really limited in advancing this research based on restrictions on health data. We are trying to collaborate with CDC's Environmental Public Health Tracking System. They have data on obesity and asthma and other environmental illnesses at the tract level for states where the program is active, and we're really hoping that's going to be a strong collaboration in the future. We think there would be a lot to be gained through collaboration with schools for test scores and possibly information on drugs that are administered throughout the day to students for ADHD and asthma and other things that school nurses administer that could really help in research. Same with pharmacies, trying to get data on sales of pharmaceuticals in different areas. At least you'd have sort of a distribution area for different drugstores to work with. An idea we're really trying to pursue, like one school at a time, is working with schools of public health where their students have access through professors, IRBs, and other arrangements to individually identified health data. And these data from the Atlas are publicly available. We're happy to provide any data for other people who have more of the capacity and facility to work with the public health epidemiology data to do at least association analyses to confirm some of what we've seen in the literature and see how transferable it is, how true it is in different types of cultures and different geographies. So thank you very much for your attention. I'm looking forward to the discussion.